And we are recording. Go ahead, Laurel.
Okay, so basically, I actually have both case studies from my first client here, because once I get to the second one, I actually have like a question or two for you. But the one I'm going to present then is her my first client encounter with this particular client. So she is female, age 25, in her Pitta age, and she's living in Massachusetts. I thought it would be good to, include where the person was, because that obviously factors in with seasonal type things. And she came in, and when I had her fill out my form and her Agni assessment, and after talking, we established that she has quite a lot of digestive complaints, as well as menstrual complaints. So her main health concerns are indigestion, a lack of appetite, varying between constipation and diarrhea, and then just a lot of like bloating, abdominal pain, distension, and gas. And she also has PMDD. Her additional like causative factors was that she just moved back to Massachusetts after living for 2 years in California. And she also just last month started an extensive treatment program for eating disorders. She's struggled with eating disorders like on and off throughout her like teenage and then adult life. But she hasn't been doing, really badly in the last couple of years, but she really wanted to, when she moved back to Massachusetts and it was covered by her insurance, she wanted to get back into a program that just helped her get back on track, because she has a hard time sometimes, getting herself to eat and eat the right things. So she's in a pretty comprehensive plan for that, where she goes to daily therapy, and they have her on like a meal plan that's not necessarily what she's eating, but for when she's eating throughout the day. So after doing her Agni assessment, I'm pretty positive she has Vashama Agni, just due to her like really irregular digestion and really irregular appetite, as well as elimination. Some days having constipation, some days having diarrhea. And she says that even on days when she is able to go to the bathroom or goes a lot, that it feels incomplete. So that, at least to me, sounds like there may be some a buildup in her intestines. Also, bloating, gas, burping, heartburn, heaviness. I mean, basically, like when we did the Agni assessment, I mean, everything that we went through, she checked off, at some point or another. She says that she has pretty much any and all digestive complaints. And she thinks that she has food intolerances, but she has a hard time determining what those may be. So after going through the subdoshas, focusing, like I said, we talked so much in our like first client encounter about like all her digestive issues that you'll see once I explain like her second encounter with me. Like we did ultimately find that she has a lot of other complaints, but for this first one we had talked so in depth about her digestive stuff that was just kind of what we started with. So I found that her hold on one second.
This is the easiest case study you could find, right?
So in her Samanavayu, obviously shows from the indigestion, lack of appetite, bloating, heaviness, as well as Apanavayu.
So Laurel, I just want to, before you go on, sorry to interrupt you. So when you started the consultation, what is it that she wanted out of the consult? Because she's got like 9 or 10 issues going on. What was her intention?
Well, so her main intention when we first met was to focus on like some of the digestive stuff. She's trying to figure out what foods are potentially aggravating her more, and she wants to know like what she should be eating and can be eating that may help to, you know, alleviate some of her digestive complaints.
Okay, got it.
Okay. So regarding the apana vayu or vata, due to her IBS, constipation, diarrhea, bloating, abdominal pain, as well as her menstrual pain, which I'll get into in a few once we get down to the women's health. The Pachaka Pitta, due to the hyperacidity, heartburn, indigestion, and her history of anorexia, as well as a little bit of bulimia, but mostly anorexia. The Baraka Kapha, due to her lack of appetite, dry mouth and tongue, and the Kladaka Kapha, because of her obsessive eating habits, also the hyperacidity, the lack of appetite, and the dry mouth. So when we started talking about her cycles for women's health, she says that she used to have very regular cycles that were typically like 2 days medium flow, 2 days light flow, and then another 2 days of medium flow. Typically she has pretty significant cramps, bloating, and she also has more loose stools just starting and during her cycle. And she says that she also suffers from kind of like cold and flu-like symptoms when she has her cycles. She just feels like really run down, and often she actually gets like cold sometimes along with her cycle.
Quick question. When did her bulimia start? Was she a teenager then? Like she's 25 now.
Yeah, so that started in her teenage years. Yeah, probably. I think she around like 13 or 14. Yeah. Like, so probably around the same time that she first began menstruating.
So do you think she will follow this?
Well, that's what we're gonna find out, I guess. She really wants to feel better, and she's really interested in like pretty much all avenues of like alternative health, really just trying to find, you know, what's gonna help her. So I think that she can follow this, but I think the really important thing is when like I'm encouraging her to eat more of certain foods and less of other foods, that it doesn't become like a restrictive thing for her, because I know that in the past, you know, when she's been seeing like a certain nutritionist or someone like that who's maybe suggested a gluten-free diet or something, for example, that can potentially like exacerbate the mental and emotional like connotations of her eating disorder. And it becomes sort of like, oh, well, if I can't eat this, then like, you know, maybe I just won't eat this meal at all. You know what I mean? So I feel like when going through the protocol with her, I was very careful, you know, not to tell her like, don't eat any of this, versus just kind of like favor this over this. Does that make sense?
Yeah. Okay. So this is really, you gave excellent protocols and seems like you did a really good job. But this is a little bit complicated case study.
Yeah. Well, so especially when I get into like this the second client encounter with her, do you want me to jump ahead to that?
Oh, so she's the same person?
Yeah.
Yeah, you
So
might as
that's
well finish it
well,
because I
so
have, yeah, okay, go ahead.
yeah, so that's why I wanted to bring both up, because I wasn't entirely sure of like what the protocol should be after like hearing about all of her symptoms, because it almost sounded like all of her doshas were imbalanced, and I didn't know, you know, what to treat first, I guess. So anyways, when we met for the second time, we talked a lot more about her like mental and emotional stuff. So she suffers from depression and anxiety and PTSD from being sexually assaulted as a child. And so I think that all of that, you know, ties into her eating disorder and her like body dysmorphia and that kind of thing. So we talked a lot about, like I said, her mental and emotional stuff. Her, like, she's, you know, been diagnosed with ADHD and, like I said, anxiety and depression, all these things. And she's, over the years, she's been on a number of different medications for things, but she's trying to be on less at this point.
If she's on antidepressants, they cause a lot of nausea and dizziness, and they do affect your appetite.
Yeah.
Especially I don't know if she's on SSRIs or she's on
Yep.
I don't
I
know.
think an SSRI.
Yeah.
So other, regular complaints of hers is she just, is chronically fatigued. She gets dizzy. She has like upper respiratory issues like asthma, and she frequently has sinus infections and like bronchitis type infections. And when she's living in this climate, she's had like pneumonia a couple of times. I know that she was doing better when she was in California. I mean, she lived in Southern California, which really doesn't surprise me for that, because a lot of her stuff is definitely exacerbated by excess vata, it sounds like. So yeah, when I went through the subdoshas for her, I added pranavayu for her, like low energy, fatigue, shortness of breath, asthma, and the reoccurring bronchitis and pneumonia, as well as the fear, anxiety, and trouble concentrating. Sorry, I can't talk. And then what else did I add? I added a bunch of both like pitta and kapha subdoshas. So let me see, the Sattaka Pitta for her irritability, sadness, trouble concentrating, ADHD. She also, under the Alashaka Pitta, she has like sensitivity to light, and she says she sometimes has like trouble with her vision, like kind of like tunnel vision type thing, and that seems to go along sometimes with like her dizziness. As well as skin stuff. She has eczema and rashes sometimes, and numbness in her hands and feet. So yeah, let's see. Can you pronounce this one for me? I'm sorry. I struggle with the
Avalambaka.
Avalambaka kapha. Okay, thank you. I didn't want to butcher it.
Pachak. At least we did the Pachaka. Pachaka was the one that was the funniest.
Okay.
Yeah, someone did a client encounter and said Pachaka, and I said, "What is Pachaka?" Sadak, Alochak, Brajak, Avalambak, Bodhak, Kledak. There is no in Sanskrit. There is no syllable stress.
Okay.
So you can't have bodhak or bodhaka. It is bodhak. There is no syllable stress.
Well, I'm looking forward to the Sanskrit lesson in our next next round of classes.
Yeah. No, it's gonna be fun. Okay, it is so much. Okay, you can totally take this client and keep on seeing her over the next. Don't leave her. She probably needs you now.
Yeah,
no, it's just she has a psychological disorder, which kind of that takes over all the issues that she has. It's all psychological, because eating disorders are American Psychological Association has only now it has 4 disorders. There's pica, there's bulimia, and there is that anorexia nervosa. And obviously I'm not a psychologist, but if for her, seeing a psychologist and doing holistic things to balance her mind are far more important than eating the right things. And I've had people like this. They need a lot of hand holding, and she needs a friend. So this is, you could be there for her. But I know it looks really, really, oh my God, complicated. But all her issues, if you look at her, all of them are stemming from a psychological disorder. And then many of her issues, if she's on drugs for depression, like the whole dizziness and sinus and headaches and digestive complaints, they're the result of these drugs.
Yeah.
So what is it? I mean, if you were an Ayurveda counselor, What was it that you could do, like starting today, that was going to start helping her today, tonight?
I mean, I think that like the number one things that I would have emphasized with her would to be
Pranayam.
yeah, exactly. Breathing
Yes.
meditation and like gentle kind of like restorative yoga type poses, like nothing too, nothing too intense, but just things to kind of get her moving a little bit, get things flowing. And also I feel like having an established like routine is really good for her, because I know it sounds like,
Yeah.
some days she'll do everything and then she'll, just lay in bed the entire next day. So I think establishing a routine for when she wakes up and when she goes to bed, obviously like through her like eating disorder program, they've had her on like a specific like mealtime schedule, which I think is really beneficial, for her, not just her like emotions, but for her digestive system to just get used to, like being fed regularly, where I know that, with her restricting issues in the past, it could be, very few and far between with meals. So obviously, that could really, really imbalance your Agni if, you're eating a lot one day and then not for 3 days.
Yeah, no, pranayam, yoga. And another thing that I find is if she can get head massages. I just posted a video of how to give a head massage from the Feb 25th workshop. I don't
Where
know
is
if
it posted?
I actually posted it on the website. Let me just share it. Hang on a second. Um, I have to now figure out how this thing works. Okay. Let's see. I'm going to open the... Okay. 1 second. Just give me 1 second. Can you see the... Here it is.
Yeah. Oh, okay.
So do you see... Let me just... So right, I started with a couple of marmas here. So right that third eye marma there.
Okay.
Yeah. So you see, that's a sandalwood paste. So, what is happening is when someone has some kind of psychological disorder, and also this is your Adhipati Marma, which is also your Brahmarundra chakra on the top of the head.
Mm-hmm.
This is your third eye, and they control prana. And as somebody who gets issues with prana vahashotas regularly, because I'm a kapha person,
Mm-hmm.
this also controls your prana vahashotas are very much linked with your manovaha shrotasas, which are your shrotasas. Shrotasas are channels of the mind. So, irrespective of anybody with any kind of depression or sadness, anxiety, and I know you feel like very helpless because we are teaching you about food, food, food. But this would be far more beneficial.
Okay.
The food is, of course, beneficial, and everything you recommended is beneficial.
Mm-hmm.
But in her case, these things, Vihar would take precedence because her issues are the digestive complaints are symptomatic. It's not the root cause. The root cause is coming from the head, from her psychology. And calming her marmas down, calming her pranavahashotas and manovahashotas is top priority.
Okay.
So here, this is like a sandalwood turmeric paste. I actually used it's called Vico turmeric paste because Vico turmeric Ayurvedic cream is like $6 at an Indian store. And this is the Shankamarma. I just recorded the whole, like they were just the whole thing.
Mm-hmm.
And then I've uploaded it. And this is your Adhipati Marma. This is how you find it. When you touch it, as soon as you touch so person will, you see me? So
Mm-hmm.
I take my hand and I put it here, then I put it here. And try to find the place which feels sensitive right here. It's that plate where your fontanelle was. It will feel just a little tender. For me, it's very tender because I have a cold.
Okay.
And this is where you can apply oils, vata pacifying oils, pitta pacifying oils, and just, she doesn't even have to do it. She can hold it. And holding the oil there is called pichu. Pichu is an Ayurvedic term. It's like putting oil and putting a band-aid on it. You can also take, so that is a really good one. Let's see. He's in La La Land, isn't he, Connor? And then the massages, yeah, he's like, oh my God, he's in. So I'm using if I make a claw here, the tip of the fingers.
Mm-hmm.
And the right and the left side of the body, it works together. Yeah, let's see if I do anything else. And you keep on putting oil. So this is going to be one, of course, Shirodhara is another thing that would help her. But Shirodhara can be expensive if she can find someone to do Shirodhara. Shirodhara, there's no even touching, it's just oil on the middle of the head.
Mm-hmm.
Yeah, and here this would have, so there are, okay, let me start here. So you have, right in the occipital area, there's a marma here, there's marmas here, and, putting essential oils of jasmine and rose and sandalwood would help. Also, she should use a lot of aromatherapy. The reason being,
Okay.
Holistically, aromatherapy will, yeah, I'll just keep on playing that. What happens is aromatherapy, when you put something in your nose, just behind the sinuses is our brain, it immediately changes your brain chemistry. So it can almost have a same effect sometimes, like what an opioid would do to you if you're sensitive to that. Sounds like she would be sensitive. So try, a combination permutation of certain essential oils that might work for her: lemon, lavender, rose, cinnamon, geranium, frankincense, cloves. I use cloves all the time, an essential oil of clove. Like right now I have a sinusitis, so now it's gone. I had it last week, so I was doing nasya and putting clove oil, because anything with head and brain and pranavaha shrotasis, this and pranayam, doing the uh, alternate breathing, alom vilom and nadi shodhana, would be top. So are you a yoga teacher?
No.
Okay, so if you can, I don't know, you should definitely, if you're going to be an Ayurveda counselor in the future, meet up with yoga teachers.
Yeah, I actually, I plan to become a yoga teacher. I work in a yoga studio. I manage one.
So is there anybody who knows pranayam?
Yeah, absolutely.
So have your friend, work with the person who do pranayam. And pranayam should be the focus of their practice. And yoga poses for her, she should do yoga, should be restorative yoga. And forward bends and restorative yoga, the whole moving around. And also people with psychological disorder, they might not eat, but they do need energy. So, oiling the body, self-abhyanga, and getting oil that way, is good. You get some calories and then that way. All right, I figured this out. All right. This is, yeah. Oh. Yeah, and of course, everything you mentioned, everything's great. Her body, I don't even know what's happening with the colon. If someone has had a history of bulimia, there's so much stuff like karmically that you don't want to tell them, obviously.
Yeah.
What happens is grain is an energy given by God to us. And when you're either vomiting it out or you don't like it or you don't want to eat it, there's like a karmic retribution that you get. I wouldn't even give her grains if they're not offered. So she has to make a whole ritual. I'm not saying eat it. Take some grain and actually work with the grain, cook with it. Maybe knead a grain, maybe do some kneading.
Okay.
Give it some love, and she make it for someone else if not for herself.
Mm-hmm.
I give you one. I had one lady who had anorexia nervosa as a child, but she was now 35, and she hadn't had an incident in 10 years.
Mm-hmm.
But she developed a lot of allergies, and it was, of course, she had worked with a psychologist, everything. Now everything was fine, and now she was trying to have a baby, and
Mm-hmm.
she's like, I don't know what's happening with this allergies. And I said, well, you disrespected Mother Nature and her grains for, some years.
Hmm.
And so this is a karmic thing. So I had her actually do charity of grains to handicapped people.
Hmm.
So she had some, a blind association near her house. She had a temple. She had some. So I told her, get bags of grains like rice or wheat and go do charity. You can get like a big. So she bought 2 kilos or 10-pound basmati, and went and donated it to the temple, and some donation to food, actual food
Mm-hmm.
donation to the blind association. And then I had her start because the karma you have to, there's some karmic thing there.
Mm-hmm.
So um I am very particular. I'm saying this Ayurveda is not just about what food we can give you.
Mm-hmm.
We look at everything. So I also see a lot of karma
Mm-hmm.
from her previous life here. So doing yoga, doing puja, doing Hanuman Chalisa, pranayam, these are the things I would give her over all of this.
Okay.
I mean, I would give her this too. And of course, sometimes you can have a great yoga community.
Mm-hmm.
So if you know the yoga teachers that she can go to who will give her support,
Mm-hmm.
that would really help her.
Yeah, I unfortunately live like 4 hours away from her, but
I mean, if
I
she
can
can
probably
find
find some in
someone.
her. I can probably help her find some in her area though, for sure. Yeah.
Yeah. All right. I hope that was helpful.
Yeah, it was really helpful for me. Thank you. Yeah, because like I said, when I had met with her originally, like we really just mostly talked about her digestive stuff. But then by the second time we met, it was clear there was a lot more, psychosomatic kind of stuff factoring in.
Yeah, this is just not, digestion isn't the result of other stuff.
Mm-hmm.
Yeah. And I'm glad we had a case study like this because we've only focused on the food, but we have to focus on the causative factor. Here, the causative factor is not what she's eating or not eating,
Mm-hmm.
is her mind.
Mm-hmm.
Okay, I'm going to take a 2-minute break and we'll start again.
Thank you.
All right, I'm back. So who all do we have here? Did anybody have any questions for Laura? Sorry, I didn't give you a chance to ask her questions. So you will see a chat window.
Manjulalaji, can you hear me?
Yeah, she said to go ahead in the chat.
Oh, okay. Okay. So my case study is female, and she is mid-age, about 44, and she is in Pitta age. And I put Ayurveda age is Vata Pitta, but it is actually Pitta age. And Prakriti and Vikriti. Oh, I have different numbers for Prakriti here. I'm sorry, that needs to be interchanged. I'm so sorry. Vikriti is V18P5K2. That is Vikriti. It's not Prakriti, that's Vikriti. And this is Prakriti. So basically her Vikriti has increased, Vata increased, and Pitta decreased, and Kapha decreased. And then her Agni, Malapariksha, Dikshana Agni and Mandagini, because this is, I think, combination. Why it is because her digestion is poor, and she has mild appetite, and what happens right now is looks like she went to the doctor, and she has acid reflux for a long time, and recently she did the endoscopy, and it came out that she has gastric ulcer. So that's the one she wants to mainly focus on right now through Ayurveda, because she is already experience of Ayurveda. She went to went to India. She went to Ayurvedic doctor, and then did Panchakarma and everything like a year ago. So that's the time all her medicine did not work because she had an issue with her acid reflux. And then when she come back, she had the same thing, digestion issue, a lot of things going on. So she went to see the doctor, and then have her the doctor have her take the endoscopy, and they recently last month diagnosed as gastric ulcer. So the symptom of that, she is having stomach burn when she is before she is eating, the general ulcer symptom. Before she is eating, she started her stomach burn, and then after that she is okay. And while she is eating, after 5 or 6 bites, she gets full, kind of, she doesn't want to eat anymore. So those kind of things. So here is my question, like she has ulcer, which is like a Visham Dikshagni, but also she has slow digestion or heavy as soon as she eats 5 or 6 bites. So I think that is Mandagini. So that's why I put Dikshanagni and Mandagini. And then usually sometimes she has gastric, feeling like gas in her stomach and bloating. Main problem is, she said acid reflux, but the endoscopy result comes as gastric ulcer. And then she has a bowel movement, like a 1 or 2, one at least every day, no constipation. But sometimes she has the second one in the afternoon or evening. And then so she is very active lady. Her So I put the acid reflux and stomach. Also, she has a throat burn. When she talks a lot, she's having throat burn. That is there for at least throughout the day, I think. And then her tongue is also like burning sensation, like when we eat something hot. So that time we feel some kind of a thickness in our tongue, right? So those kind of feelings she has. So sometimes she couldn't taste the food because of that. Mm, and but she doesn't have any ama. I asked her to check her in the mirror, but she doesn't have any ama. And then so dryness in the mouth is there. And yesterday she called and then told me that she has dryness in the nose as well. So I think her kapha maybe got a little bit affected too. Um, so these are her symptoms and common health issues that she wants to address by this study. And then so she's I think she's a pitta imbalance now, since she has a lot of digestion issue going on. um, Maybe since she's basically vata person, and vata has increased. So I have a doubt too that she might be affected by all the dosha here. Protocol, I told her that to take some licorice with honey and ghee in the morning, but she hasn't started that yet. But she's started I asked her to take some coconut that would help for ulcer. So in the morning, every day morning, in the empty stomach, asked her to take coconut, just have to like a 1 or 2 no, like about 6 inch of coconut, just chew it and then drink the juice, and then spit the fiber at the end. So she is following that for the past couple of 2 weeks. And then asked her to take some buttermilk for the probiotic, buttermilk with jeera and stuff like that. And I was thinking to start asking her to take the appetite increasing protocol, the kashayam with fennel seed, ginger, little bit, because she is pitta imbalance right now. So little bit ginger, and then cinnamon and cardamom. So that will increase her appetite, I guess. So I was planning to suggest her that. So Sabdosha, she is obviously Pachak Pitta because of her digestion issue, and Samanavata because as soon as she eats, she is feeling heavy. And Kledaka Kapha, I think, because of her dryness in the mouth, and as well as dryness in the nose. So basically, she's very nice, organized, creative lady. So very disciplined, and nothing wrong in her job. A little bit of home pressure because she has 7-year-old daughter at home, so she needs to make her happy all the time. And then she's very active little girl, so she wants to make her engaged all the time, so running around basically. And she is walking a lot. um, um, she is working for a very big company, and she's kind of she's like a quality manager there, I think. So she likes her job really. So I don't think so she has some she has any work pressure there, but don't know why the ulcer came. And then she has some body aches sometimes, but that's shoulder pain. It is because of her posture, I think. So that's what she went for the Ayurvedic treatment, 10 years ago, and that time it was working well for her. But this last year when she went to Panchakarma and then Ayurvedic treatment, that time it did not suit her because of the digestion issue, the acid reflux issue. And so last month she got sick with influenza, and she got 104-degree fever. I think it's because of her immunity is low right now. So this is her health issues. And then one more thing, she is done with her menopause. Her menopause stopped. Basically, she's Vata woman, general cramping, and she has like a variable cramping, but a steady flow, which is to the second and third day she has peak flow, and then it is slowly 4 or 5 days, fourth or fifth day it is slowly going down. Yeah, it stopped. The menopause is stopped on July 2015, but it came back again this year in February. And she went to the doctor. The doctor said that it is all done because they did some hormonal test, and then they concluded that she has done with her menopause. But after like a 1 year or so, so this year 2017 February, she got again one time bleeding, and she was so worried about that, and then she went for testing also. To the doctor asked her to take a if there is a precancerous issue going on. So she went to see the doctor. Luckily there is nothing wrong in her body, and there is no like alarming thing that needs to worry about. um, so so that's all on her menopause issues. And then
Kavitaji, I'm just going to write everything on a... I'm
okay.
still having an itchy throat, unfortunately.
Yeah,
So
sure.
I've been writing things here, and I'll just write it on here. So just take notes because it doesn't get saved.
Okay.
Does anyone else have any questions?
Vidaji, I have a question. This Viro. So
yeah, Viro, go ahead.
Can you hear me?
Yeah, I can.
Is she taking any like medications or supplements?
She's not taking any supplements. The doctor asked her to take vitamin D, but I think she's not started. And for the ulcer, there is ulcer medicine. It's called some. Okay, let me read it. Did I put it there? Yeah, she's taking ulcer medication now. She just started.
Okay, because I saw when you wrote the Agni, Tikshnagni and Mandagni, I was wondering if she's taking something and the ulcers are secondary to something she's taking. You know what I mean?
Yeah, she totally forgot. She mentioned yesterday night that she has thyroid for 7 years.
Oh, okay. I wonder if she's taking something for that. Maybe it's being caused by that.
If they'll give thyroid medication, the whole point of thyroid medication is to increase Agni.
I see. Okay.
Yeah.
So I was also thinking all of this, the burning tongue and throat burn and food is tasteless. There's a little bit something else going on. These are pre-symptoms of fatigue issues.
Yeah.
Which I was thinking, well, why is fatigue not mentioned? So I understand. So she's actually fatigued, but the thyroid medication will increase metabolism, giving an impression that you have more energy than you really have. Does it make sense?
Yeah.
Plus, it does. It does increase the heat in the body, and she doesn't need. And especially when she was going through her menopause. When you're going through your menopause, the heat in your body is increased because of hormones anyway. I believe there's some hormonal issues were going on at the time, and because that's why she got ulcers. Where did she get panchakarma? She should have been given rice gruel with ghee.
She took it in Tamil Nadu in India.
I don't know what they gave her. So, Viro and Tatiana, the next 3 weeks as you start counselor, we'll be doing this diet. So if you don't mind, Kavita, we will use your case study in my class.
Yeah, sure.
So Manda, Yepa, Vilepi are Pathya. Pathya is when a diet is given to a sick person, which are different forms of gruel. So she has an ulcer, she has fatigue, and I know that, they just do not have the bandwidth to go into it, but the burning tongue, throat burn, food tasteless, this shows me there's some fatigue, autoimmune issue in the future may happen.
Oh, okay.
Absolutely no ginger, I wrote it there.
Oh, okay. So the other things is okay, Manjulaliji, for
Very good. Both you and Laurel did an awesome job. You guys are like ready to go and kick down the doors and get started. I'm very proud. Good job. The thing is, yes, it is. You guys get confused because you're trying to do really complicated things, and counselors. So this is like, you see, the sotas get imbalanced in 4 ways. So I don't know what is the form of an ulcer, but ulcer is actually happening when the Pachak Pitta starts eating the portion of Annavaha Shota. So the lining of stomach has been degraded and eaten by the Pachak Pitta.
Okay.
So this is an issue, like a physical issue with the Srota. Only thing she can eat is gruels, nothing else. And no walking. Oh my God.
Yeah, I was.
Especially during noon time. She cannot walk it during noon because she's already increasing the heat.
Okay.
And so she has some kind of autoimmune in the future going on, so please tell her to be careful.
Okay.
I had someone with burning tongue. She went to, like, I'm not going to record it because I can't talk about her hang on a second.